Hi everyone, I'm Dorte Bladt. Thank you so much for inviting me to be part of your Lions of Chiropractic coming all the way from Australia. It's a real pleasure to get a chance to chat to you. Now I want to share a little story about a little person I saw when he started coming in about a month ago, little Rookie. Mum brought him in because Rookie was developing a flat spot on his head, and she had heard that chiropractic was really good with that, so she brought him in. It soon turned out, though, that that was probably the least of her concerns. What was happening more on a distressing point of view was the fact that it appeared Rookie wasn't growing as was expected. He wasn't putting on weight as expected. And the doctors and the health nurse was really pushing very, very hard for Rookie to be given some formula to be pump fed. And Mum was not particularly happy with that. Basically, Rookie was putting on 130 grams a week, and at this age, he was 3 months old. At this age, they'd like to see 150 to 200 grams per week weight gain. But curiously, Rookie had been a real porker when he was first born. So he was huge, really long, really fat. And that wasn't continuing. He was now at 3 months actually falling through his percentiles, his growth percentiles. Mum was about this big, so tiny. Now, those of you who know me know that that's actually not that tiny, but you know, she was probably on the smaller side of average, and Dad was not much taller. So obviously, Rookie at some point or another would have to find his normal growth trajectory. And I think that that's what was happening. Rookie was feeding many, many times a day. He was still waking up 3 times a night for a feed. He seemed to be emptying the breast quite well. He was quite happy on the breast. He was smiley, he was alert, he was communicating. He had plenty of wet and dirty nappies. He was reaching his growth motor milestones. As far as I could tell, this was definitely not a case of failure to thrive, but more a case of, as I say, maybe just trying to reach his growth trajectory, which was probably not going to be humongous. What I'm finding, though, is that this is quite a common problem in Australia. I'm not sure what it's like in the UK, but I feel that doctors are really, really pushing mums a lot with the question of their milk being of good quality, if they have enough, if they are, feeding frequently enough. And there's a real push both for cup feeding, but also for swapping to only formula feeding. And there's also a real push for starting solids very early. And when I say very early, I say from about 3 or 4 months old, which I find quite distressing and upsetting and not real good for our next generation. Now, I'm not here to talk about breastfeeding today, I promise. But what I do want to do is to, give you some tools so you can help mums, tools and information, I suppose, so you can help mums be confident in their ability to feed and in their knowledge that they're doing the best they possibly can for the next generation. But maybe more importantly, depending on who you are, I actually want to use breastfeeding as a fantastic referral tool. Breastfeeding is one of those topics that you can discuss with grandparents and sisters and friends and whatever. By having some information and some really good facts that you can share with not necessarily the mum, but with her family and friends, this may be a really good way to actually get her on the care. So that's what I would like to share with you today. And I'm just going to start my presentation, which is called Bobs and Boobs. Trying to come up with something interesting, so I hope you like this. Now, to start, just a little bit about me. I am a chiropractor, graduated from Palmer forever and ever ago. I have always had a special interest in working with children. I have a certificate in neurodevelopmental disorders, so kids with autism and ADHD and stuff. They're quite a commonplace in my practice. I also have a master's in chiropractic pediatrics, and I started teaching other chiropractors about caring for children way back when in 2006. And I am really passionate about us having a whole range of people in our practices. I actually run a family practice. I'm not a pediatric chiropractor. I'm very much a family chiropractor. And I'm, as I say, passionate about us all being able to have from day one to, great-great-great-grandma in our practices and being able to provide the appropriate care, because it's obviously quite different from one end to the other. In 2015, from memory, I wrote a book, Speak Strong Kids. This was more aimed at the parents. Obviously, the seminars are for chiropractors. So the Speak Strong Kids book goes through things you can do to stimulate a child's brain to make sure that they do the best they can. But this is very much through the chiropractic lens. And then in 16, or maybe that was in 15, I started the Kids Summit, which is another passion of mine. The Kids Summit is a fundraising initiative, having seminars around the world, but really raising funds for research into chiropractic care for children, something I think we need to be better at, because there's not a lot backing up what we do when we work with kids. So, breastfeeding recommendations. Well, it is no news to anybody that breastfeeding is being recommended for the best type of food for babies across the world. This is recommended by the World Health Organization, UNICEF, from the Academy, American Academy of Pediatricians, as well as the Australian NHMRC. So everyone says that really breastfeeding should be initiated from the word go. And the baby's born, should be placed on mom's tummy, and then preferably find a way to the breast. And then that should be the only way of feeding for the first 6 months. After 6 months, we should start introducing complementary foods, healthy complementary foods. But really, for the first at least 12 months, breast milk is the main sustenance. That is actually where we get our nutrients from, and the solids are really just there for us to get used to eating other foods. But they actually recommend that breastfeeding is continued up to age 2, and preferably even beyond that. Now, it is actually estimated that if we had pretty well universal breastfeeding across the world, 800,000 lives would be saved per year. Most of those being babies under 6 months of age, but also mums. There is less risk of breast cancer, ovarian cancer, type 2 diabetes, and heart disease if mum is breastfeeding. So I'm sure that this is not something I need to convince you about, but it is quite important, I think, that we can get that message across to the parents in our practices. Another thing that I don't have to talk to you about is the absolutely incredible sustenance that is in breast milk. When you compare the list of ingredients in breast milk to formula, this is ridiculous, because we don't know half of what's in breast milk. We know, though, that breast milk has the perfect combination of proteins, of fats, carbohydrates, immunoglobulins, vitamins, minerals, oligosaccharides, microbes, lactoferrins, and they will suit the baby. The combination of these essential nutrients will suit the baby right now, right here, and will be different tomorrow and will be different next month. Of course, the combination of nutrients will change as the baby gets older. It will also change from the start to the finish of a feed. It even changes depending on what time of day that baby's feeding. There's actually more melatonin in the feed in the milk that the baby's fed at night. Now, they've also found that there's a difference in the milk composition depending on whether you've got a boy or a girl. Colostrum, which is the substance that is made before the milk comes in, at day 3 or day 5, or however long that takes. And that contains live stem cells for building brains, livers, bones, everything. It also has lots of proteins that actually will line the intestinal tract, to cover up those holes that we know that are still there between the cells to keep out, harmful bacteria. So the breast milk is specifically tailored to the baby and what the baby needs at this particular time. If the baby is unwell, it has been found that by breastfeeding, the bacteria enters the areola, the nipple, and the mom will actually produce the milk and the antibodies that is required for the baby that is unwell at that time. The same thing with mom kissing baby all over. There is an uptake in mom that actually senses, okay, well, at this point, this little baby's got a cold. We need more of, whatever, but a different type of immunoglobulins. So very, very important to feed. Another thing that's also very important is the stress of being able to feed. A newborn baby's tummy is actually the size, now here there's a cherry, it's actually the size of a small marble, if that's a better visual for you. It is really only a couple of teaspoonfuls that there's room for. Within a week, 10 days, it increases to the size of a big marble. Here we've got an apricot, so it increases by 10 times. So it is not common early on that there is a risk or an issue with supply. There may be an issue with that later on, but supply and demand will tend to sort that out very, very quickly. Again, continuing on with breastfeeding, the benefits for a baby I can't even tell you how many there are, but to start with, we're looking at the way that it builds our future immune function. So breastfeeding, being vaginally born and breastfeeding will start, it will seed the baby's gut, which will then make the foundation for the future immune function and ability, which of course then reduces the risk of childhood infections, it reduces risks of hospitalization. Breastfeeding also has been shown to increase the bond, the attachment between mother and baby, and there's a risk of a decrease in the risk of SIDS, colic, allergies, and it has also been shown to increase the IQ of the baby. For mom, there is a decreased, decreased risk of excessive weight gain when you're breastfeeding. And underneath my picture there, it says the decreased risk of postnatal depression, which is such a huge issue at this particular time. And as I mentioned, less risk of breast and ovarian cancers, type 2 diabetes, osteoporosis, as well as heart disease. Now, the thing to remember, of course, is that breastfeeding is a choice. It is mom's and partner's choice. It is not our choice. It is always our job to support mom and partner in whatever choice they have made. However, in some places in the world, it is not necessarily a very positive environment for breastfeeding, and we want to make sure that we don't come across like that. So in your practices, make sure that moms are always, comfortable doing whatever they have to and whatever they want to. Now, that may mean that you give them a separate area to breastfeed in. It could also mean that you are providing a breastfeeding chair. You might have some pillows around, but you want to make sure that breastfeeding is always, very welcome. There's no hard feelings, and you don't have to cover up one or the other. Now, let's go to what happens in the UK. Now, UK leads in many different sectors in the world, but sadly, breastfeeding is not one of them. Actually, breastfeeding is at its lowest level of anywhere else in the world in the UK. So congratulations, you're doing well, right? 81%, sorry, my dog is going crazy. Is starting to breastfeed at birth. So many obviously have the intention to, but within the first week, already about half have had at least one formula. And that goes sharply downhill. So at 3 months, it is only 17% of UK mums that exclusively breastfeed. And at the age of 12 months, only 0.5% are breastfed at all. And that is so sad, and something that I think that we as chiropractors should really take on and try to see if we can help make a bit more common. So some of the things that may impact breastfeeding, well, they're quite varied, and I have only taken a couple, but just some things to consider when we're looking at the diet. Of course, we know that we're always talking of the relationship between mom and bub. And then we also have the relationship between mom and whatever else is going on. But breastfeeding or successive breastfeeding has to do with the ability of the baby and the ability of the mom. Moms will always take it on as, oh, it's my fault, I'm not producing enough milk, it's my fault, I'm stressing, it's my fault. Which is that's the job of a mom, to feel bad about what she's doing. But the point is still that it is a diet, it's a relationship. So when we're addressing breastfeeding, we need to look at it from both sides. Now, it is very well known that birth intervention cascades. It starts as a little bit of induction or whatever, and it goes downhill, and there's more and more intervention, and that intervention interferes with the ability to breastfeed. When we're looking at normal births, so when we're looking at the number of births in the UK where there is no intervention, as in no induction, no forceps, no cesarean, it is only 20% of mums that actually have a normal birth, and only 15% of mums have given birth for the first time. So that's shocking statistic. 29% of mums in the UK are induced, which is fairly even with the rest of the developed world. 13% you see that they're on tools or forceps. There might be a clip on the head, measuring the heartbeat of the baby. And about 26% of births in the UK have been by cesarean, which is a little bit lower than Australia, actually, which is not something we're too proud about down here. Now, when I say birth intervention, I expect that most of you will sit there and think, oh, birth intervention upsets the very fragile upper cervical complex, and there is a significant risk of atlas, vagus, the whole system, the nervous system not working well, and that could lead to subluxation patterns, and that could lead to feeding problems. And I guess that's actually what I'm trying to show you. What I find really interesting, though, is it is not just the intervention in births that cause that. This osteopathic study from 2015 looked at newborn babies, happy, healthy newborn babies, not the ones that went to NICU, not the ones that had cesareans, but the normal babies, aged 6 hours to 72 hours. So they are brand new. And they checked 100 newborn babies and found that 99% of them had at least one dysfunction. And as chiropractors, we're going to say, well, of course, were you born? You're born, you need an adjustment, of course. That's the way we look at it. There is, going through the birth canal is hard work. You've got the compression of the upper cervical complex. You may potentially have some tractioning, which is also going to cause issues both at the upper cervical, but also at the sacral level. So with a normal birth and with intervention in the birth, most babies will actually have a subluxation. And yes, that will definitely impact their ability to feed. This study was from 2015. Back in the 80s, there were quite a few other doctors that actually looked at the incidence of subluxation in newborns, and it was ranged from somewhere between 80% to about 95%. Biederman, Dr. Goodman, Dr. Fryman were all looking at that and found that yes, subluxation patterns are very, very common side effect of being born. Now, I don't just want to mention the physical side or the physical stress of being born, because obviously that is hard. We also have the potential, positioning in the womb that could cause all sorts of issues with, with shoulder pressure and, cranial pressure and stuff. Looking at toxins, that is also a subluxation producing irritant. We could have the gas that mom might be receiving through giving birth. There might be pethidine. Usually, if you've got a spinal, what am I trying to say? Epidural, there should be less interference with the baby's chemicals, but everything else will cause a drowsy, stressed baby that is probably not firing on all cylinders when it comes to nervous system function. If you add to that the stress of toxins through pregnancy, it is quite a chemical cocktail, in a brand new baby. And they found that something like 99% or 97% of mothers that have been exposed to, fertilizers, artificial chemicals on fields, or the fact that there's, fire retardant sprayed on clothing or on furniture, all that is actually found in the umbilical cord of brand new babies. Then there's a mental stress, which I think is substantial. There's so much pressure to perform in mums these days. And it's, going all the way up to, the day before, you give birth. You have to make sure that, everything looks perfect for all your Insta photos. You have to make sure that the house is spotless. You have to perform and have the proper birth, whether that is your decision to have a home birth or whether that's your decision to have a cesarean. But there's still a lot of performance stress on, what do I have to do? And then that whole issue with fear all through the pregnancy. Everything that can go wrong, and we're going to measure this, we're going to do this test, we're going to do ultrasounds because this could go wrong, that could go wrong. So there's an awful lot of emotional stress that mum is experiencing through pregnancy, but also through birth. And all that, of course, comes across straight to the baby, both as stress hormones, but also the mental stress that they pick up. So quite challenging for the baby to enter the world from that point of view. So posture is a very common component when there is breastfeeding issues. Now, of course, I mentioned little Rookie earlier on, who definitely had a left turn preference. He did not have a breast preference, but he ended up with a little bit of flatness on the one side of the head, which is often a really good reminder for parents to bring their babies to a chiropractor, because we've had quite good results with that. But when a baby comes into your practice, whether they're there for colic or whether they're there for a baby checkup, always ask, 1, does the baby have a preferred side to feed on? Or 2, does the baby put their head in a particular position? If you're not putting them in that position, is that where they are for a period of time? So check for preference. Now, that may indicate that there is an upper cervical subluxation, that there's atlas issues, and it can impact on the latch. It can impact on the tongue function. So the position of the baby's head is very important. Some babies are very locked in extension, and that will most definitely cause issue, not just with obvious nervous system function subluxation patterns, but also with the ability to do the suck, swallow, breathe. When they're in extension, the trachea is like decreased, and it's much harder to get into that pattern of the suck, swallow, breathe, which is what breastfeeding really is all about, in the rhythm of movement. If you find that the baby is stuck in extension, check them most definitely for occipital position and movement. Check atlas, check for dural tension, and have a very, very close look at the sacrum. And remember, of course, that the sacrum is 5 separate bones in a little one like this, actually until they're about 16 years old. A floppy baby is a baby with low tone. That is also a huge impact on breastfeeding. Having low tone means that the baby has to work much harder at everything they do, which is why they can't get the extension into their system. This is why they can't lift their head when they're on their tummies. It's hard work, and feeding is hard work. And feeding on the breast is much harder than feeding on a bottle. So when you have a baby that is a bit floppy, that will not do you keep not necessarily the head in line, depending on how old they are, but that will not attempt to try to lift the head up when you do the pull to sit test, it is worth spending a little bit of extra time on assessing what else is going on. If you feel that you're maybe not up to that, make sure that you get somebody else involved, get another chiropractor down the road that is maybe used to seeing kids, do a little bit of backing and forthing, whether that is that you refer for the other chiropractor to take care of the baby, or you might get a little bit of help of what to look for, but don't lose them. They need adjusting, they need a lot of adjusting. If you find that you are concerned that there's something else going on, so this is a medical low tone baby. Medical low tone could be brain injury. It could be muscular disease. It could be a metabolic disease. There are lots and lots and lots of reasons for a medical low tone baby. The thing you have to remember, though, is that input into the nervous system as an adjustment will help them. Will help stimulate the cerebellum, will help stimulate the cortex, which means that they will actually get better input into their muscles and be less floppy. That's one thing. Another thing is that the medical doctors don't do a thing. They assess them, they might refer them out for some more assessment, but really it's a watch and wait situation. So you do not want to just let them go to the doctor. You want to actually still be there and provide your care. You also want to make sure that you provide the parents with some, homework to make sure that they get some stimulation in there, because there is a strong link between low tone as a low baby or as a little baby and the risk of neurodevelopmental delays, because they don't get the stimulation to the brain. So we want to get in there and we want to be part of that care from day one if we can. So the other very important thing to advise on is positioning. Now, in Australia in particular, and I'm not sure how it is in the UK, I've got my baby, can't quite see, but mum holds the baby quite securely in the one arm. The other hand is used to guide the neck. So the baby is sort of put into extension. The nipple is put about the upper lip. When the baby opens its mouth, the baby's head is sort of forced onto the breast. And that's how most new mums are taught how to breastfeed, at least at our local hospitals. And that works for some, and that's great. But there are lots of babies, in my experience anyway, that it does not work for. What happens when you put the baby into forced extension is that you actually induce a startle head position. So it is a induced moral where the head flings back, the arms fling back to take a breath in, and there's an increase in cortisol. So this is stress hormones. They're straight into the sympathetic, stress response, fight and flight, and that is most definitely not the position to relax and get into a nice, relaxing feed. So that is probably not the best way to position the baby. Another thing is also when you have the baby lying like this, horizontally along the body, when the mom's let down comes down, and for some moms, this is, quite a forceful expulsion of milk. The baby almost drowns, and it's quite a passive engulfing. I'm trying to, keep up with this. And the baby will often pull off because this is too much. I can't breathe. Always remember that that's paramount. Breathing comes first, feeding comes second. Sensibly so. So if the baby can't feed, they'll pull off, and they might get upset, they might get stressed, they might, pull on the nipple, and it may be quite an uncomfortable journey for mum and baby when this is happening. Also, the baby obviously gets bigger and bigger, and the baby's quite heavy, and mum's sitting there for hours on end. So mum's comfort can be quite compromised when baby is in her arms. Often that is rectified by, putting cushions, all sorts of pillows underneath the arm and underneath the baby to reduce the stress on mum's shoulders and on mum's neck, and decrease the tension so it's more comfortable. The problem with this is the amount of space that is then being introduced between the baby and the mum. So there's layers of tissue, there's layers of clothing, there might be layers of pillows, which is not the best for bonding. So we actually have a separation of mom and baby, and we don't want that for anything. Bonding is, well, breastfeeding is essential for bonding, and bonding is essential for the health of the baby. There are many ways to bond, of course, and bottle feeding is fine. We just have to remember as much skin to skin as we can get, as close to the chest as we can get, so there's heart. The baby can hear your heart or mom's heart rate, and there's the warmth and the secure place. That's what we're trying to get for. Again, in the horizontal feed, you have to remember with regards to visual bonding, where baby can actually see. At this newborn age, baby's vision is about 30 to 50 centimeters, and it's about contrast. When they're stuck on your breast, all they're really looking, not on your breast, but on mom's breast, baby's looking into your armpit. And they are trying so hard to sort of look up and see if they can see mom. And that is difficult. Also, as they get a little older, they start actually pulling on the nipple, which can become quite uncomfortable. And also the whole latching position, when there's a strain in that position on that side on, it is not as easy to get the proper tongue position. It is actually easier if we turn the baby to the picture that I've shown you over here. Now, I believe it's called the straddle hold, and a brand new baby is not really going to straddle, but the idea is that the baby is actually vertical instead of horizontal. Now, mom leans back 45 degrees or however much she needs to, but she's reclining. She's got her neck support, she's got her shoulder supported, and the weight of the baby is on her chest. Now, this position is amazing for integrating the primitive reflexes because the baby actually has to use them. The baby has to, well, one, feel mom, smell mom. So they're figuring out where they need to go. So they're drooling at breast core. They're using the stepping reflex. They're using the grasping reflex. They've got the head control. So they're doing extension of the neck. And then we've got the sock swallow reflexes working as well. So we're really powering on the primitive reflexes. In addition, the baby is in total control. So leaning up against mom like this, when it gets a little bit much and it's not a passive, downhill feed, baby can lift the head off quite happily to clear the nose so baby can breathe a bit easier to get a bit more space for the head, for the mouth. What else is good about this? Oh yeah, it's much easier for baby to look up at mom. So there obviously been a little bit of extension, it's a bit hard to see here, but baby will look up, will look at your hairline, will look at mom's eyes, and will commit that to memory. So there's much more bonding, much more attachment and recognition in this position. For mom, leaning back, there's a little bit more pressure on her sacrum rather than sitting. She's actually putting pressure on the sacrum as a whole, which increases vagal stimulation and increases oxytocin release, which one increases the letdown and milk production, but also the feel-good hormones of connection with baby. There's much less strain on mom's neck because she doesn't have to carry the weight as much. She's obviously still looking down, but she's not looking to the side as much. Now, the other thing that this also does is you can obviously have baby lying straight this way. You can have baby lying across, depending on the size of the baby. So they're straddled on the other leg, but there is no hook on the elbow, so there's no actual carry in this position. So really, potentially a much more comfortable position for baby to latch on, still have that head into extension, still have the mouth, so the chin on the breast, and the airway free, but baby's much more in control. Now, what does this look like? It's a question from university, really, isn't it? Well, this is the fascia of the body, starting at the tongue and going all the way to the toes. I've only thrown this picture in here just to remind you how everything is connected to everything else. How a subluxation pattern or a tension pattern through the mouth can affect the system going all the way through. There's no nervous system on here, we're just looking at basically muscle connections. But it is essential to remember this when we're looking at something like tongue ties, lip ties, things like that, which is another more common issue these days with breastfeeding problems. That is often almost the first response if there's breastfeeding problems. It's like, oh my goodness, does she have a tongue tie? Now, tongue tie is obviously an important factor, and it's something that we as chiropractors need to know about. There's no doubt about that. But I think we also need to remember that the tie and the connection that it has to the rest of the system is not necessarily a surgical procedure. It is actually something that we are, in many cases, very capable of helping, and we should, because we don't want to babies to have surgery, from a few days old if we can help it. So you may be able to see a tie, as you can see in these pictures. They're very simple to see, very easy, and you can say straight away, this is obviously restricted. Sometimes they're much harder to see. Sometimes they're sitting much further back. But my point with this is actually that you may or may not see a tie, but it is not the visualization of a tie that's important. It is the function. Now, the tongue is supposed to be able to lift and stimulate the roof of the mouth. If it's not touching the palate, often the palate will be very high, it will be very narrow, and it's going to create cerebral spinal fluid flow issues. It's going to create cranial tension of all sorts. So it's very important that we've got that. Also, the tongue has, like the rest of the esophagus and intestines, has a peristaltic type movement. So it starts at the front of the tongue and it sort of goes like a wave and lifts. So the milk is being transferred from the front of the mouth and back to where it can be swallowed. And what we want is that the tie does not restrict that peristaltic movement, that lifting all the way through. So what you really need to do is to stick your finger in there and have a feel. Now put a glove on it or wash your hands, of course. Put your finger in baby's mouth. Remember, of course, that this reflex is only there for the first 2 to 3 months. After that, it becomes a voluntary action. But feel for the sucking. Feel that your finger's been drawn into the mouth and feel the resistance when you try to pull it out. While you're there, feel for the cheeks. Feel if they feel hypertrophied or thick. Is the baby using its cheeks to feed rather than the tongue? So that's what you want to sort of look for. Feel for sphenoid. That is an important factor in getting the palate to work properly. And there are some issues here that I put on and some things that I want you to check when you've got a baby that you think may have a tongue tie. Now, these sorts of issues I go into, quite a bit of detail with in my Switched On Kids seminars. If you're interested in learning more, come join us in Sweden. I'm doing a Switched On Kids, Switched On Baby seminar in September in Sweden, and we'll talk about this in English. Stress is another huge issue. We covered it already in the pregnancy and in the birth, but stress is just as important after birth. Remember, of course, we're talking diet, and the baby is really good at sensing the state of mom. Is mom sad? Is mom upset? Is mom stressed? Is mom worried? And the baby will actually express that with crying, with not feeding, with not latching, with colicky pains, with being upset. So when you have an upset baby, when you have a baby that doesn't feed well, it's worth asking mom, how you're going. What's life like, and you're giving some support, because it's hard. If I could, I would ask any mums in the audience there, what do you remember from the first couple of months? Most mums will say, apart from that, absolutely overwhelming love and connection, and I mean, it's like you can't even explain the feeling of the love that you feel for this newborn. the rest of it is hazy and, being exhausted and tired and stressed and worried, but that love sort of, made it all worthwhile. My sister, quite a few years ago, with her firstborn, had some issues with breastfeeding due to stress. She really, really wanted to breastfeed. And she was very concerned that she didn't have enough milk. And she stressed so much about it that she didn't have enough milk. Luckily, she was seeing a great chiro at the time who, was able to assure her that, it is a question of you and her. Once you start stressing, the milk supply will decrease and your baby will not have enough, and then she'll scream and yell at you. And here you are then, stressing even more. So as soon as they had the conversation, they were both adjusted, and, breastfeeding became I don't want to say it's never easy, but, it became a great pattern. The vagus nerve, of course, is very affected by stress, the parasympathetic system, and I don't need to tell you what the vagus is involved in, but when there's a lot of stress on the system, it will affect the way the baby feeds, the way the baby latches, colic, reflux, constipation, sleep. Everything that goes on with the baby is potentially related to vagus. And when I say vagus, what do you say? Baby needs an adjustment, right? So this is so important. So finishing up with this, what I really want to pull back to is that, okay, I have tried to give you lots of little tools that can help you with the mum and bub. They are, the end all be all. They are the ones that we want to work with. But actually having a conversation about the issues with breastfeeding with partners, friends, grandmothers, sisters, nieces, whoever that may potentially have a little baby that could need care. You and I would straight away say, you got a baby, well, the baby needs adjusting, but it's hard to sell that way. What you could say, and I find this really, really useful, is, oh, Mary, so, hey, how did it all go with your daughter's, baby? Does she have her yet? Yeah, well, she's had a little girl. Oh, so what's the name? Oh, Sophia, that is the most beautiful name. That is so gorgeous. Oh, and how's she going? Great. Is she feeding well? Okay, so see, you're starting there. Is she feeding well? How's she feeding? Oh, okay, that's interesting. And then you just drop a few little hints. Don't push too hard. Just a few little hints that indicates that you know about breastfeeding and that you can help. Now, grandma is going to be desperate to try to help her daughter if there are issues with breastfeeding, if there's issues with sleep, if there's issues with constipation, if there's issues with whatever. But if you can start having that non-confrontational conversation, she is going to go home and say, I went to the chiro today and really believe it. He or she knew so much about breastfeeding. It's probably worth you go have a check. I would very much recommend that this is a very good way to start. Now, of course, don't stop at one. When they come in next time, you're just as excited. They ask, so how's little Sophia going? Oh, that's so beautiful. Have you got a picture? If you've got time. If you don't have time, don't ask, because you don't just see one video, you see these 10. Point being, though, keep going, keep drip feeding, and hopefully at some point this family is going to, bring in a little baby, and you can start increasing the number of families in your practice, which is what we want to do, because we want to create a happier and healthier next generation in a happier and healthier world. That's what chiropractic is all about. So very briefly, Switched On Babies in Sweden in September. We've got a kids summit in Barcelona in September as well. We've got 11 speakers sharing their wits about children and chiropractic care. So please join us. And thank you so much for having me. It was a pleasure talking to you. And I hope that I actually get to meet you in person next time.